Hello and welcome to this presentation on Hispanic culture. This is a case report presentation. Your presenters are Emily Matson and Matthew Singletary, or as the slide states, it is presentado y narrado por Emily Matson and Matthew Singletary. So, a 24-year-old Hispanic parturient presents to labor and delivery in the midst of first stage active labor. Upon assessment of the patient for an epidural, you notice she doesn't speak English. She is accompanied by her husband and 2 other children, and she looks as if she is hiding periods of intense pain by masking her facial expression. With that said, what are some assumptions you should make as her healthcare provider? What barriers to effective care present in this scenario? Also, we can think about what barrier to effective care presents with the Hispanic patient in general. Furthermore, when presented with these barriers, how can we overcome them? What family dynamics that are common for a Hispanic patient do we notice? And how can we provide effective care while respecting aspects of the Hispanic ethnicity and culture? The topics we will cover today are a brief introduction to the Hispanic culture, including a review of their family values and religion. Then we will discuss unique Hispanic traditional health beliefs and how their access to healthcare may have an impact on their health. Lastly, we will discuss anesthetic considerations that we as anesthesia providers need to keep in mind in order to provide the best culturally competent care we can to the Hispanic population. First, a brief introduction into fun facts about the Hispanic culture. According to the United States Census Bureau, the Hispanic population is the second fastest growing U.S. minority. The Hispanic population now accounts for 17.1% of the total U.S. population, and this number continues to rise. The Hispanic population, as defined by the U.S. Census Bureau, refers to a person of Cuban, Mexican, Puerto Rican, Central American, South American, except for Brazil. Brazilians are considered Latino, which is slightly different than falling under the Hispanic umbrella, or other Spanish culture or origin regardless of race. With that said, in a purely anecdotal sidebar, we may encounter the Hispanic culture more in the Tampa Bay area than in some other parts of the country. This may be due to a strong influence of Cuban Americans from the South, and perhaps due to seasonal migrant workers from neighboring areas like Plant City. This may be something to keep in mind as we attend clinical in the Tampa and neighboring areas. When caring for a Hispanic patient, a provider needs to be aware of family dynamics and cultural values. According to Schneider, the basics for the Hispanic culture include aspects of personalismo, personal, genuine relationships, respecto, respect, confianza, trust, confidence, and familiarismo, familial group emphasis. Of these, importance to note, familiarismo involves valuing the family considerations over others, including the community. Often, Hispanic patients will seek family resources before medical resources. As a healthcare provider, it is important to support the family's belief system. For example, if a patient of the Hispanic culture has let an illness progress for quite some time before seeing you, know that the patient most likely sought care from internal sources like that of his/her family before turning to external sources. And this does not make for an incompetent patient. With that said, in addressing the family, know that the greatest power in the family is held by the father or oldest male relative. They often make health decisions for others in the family. Likewise, it is appropriate for females to refer to their male counterparts when making decisions on treatment options. It is not uncommon to encounter large families that accompany the patient. Keep in mind that trust, confidence, and respect are always in balance when caring for your Hispanic patients. Religion is important to most Hispanic cultures. With that said, most Hispanics are Roman Catholic. Religious considerations can be important when planning and delivering services. Along with Catholicism, there is a concurrent belief in the use of magico-religious means of dealing with life. Magico-religious include the belief that magical practices can cause a supernatural being to produce or prevent a specific circumstance, like a disease. Faith and church remain powerful sources of hope and strength in the Hispanic population, especially when facing an illness. Daily rituals of prayer, devotions, and wearing religious medallions are common. Some religious practices include daily prayer and devotions. Likewise, some relics include the settings of lit candles during prayer, pictures of saints, and medallions that consist of saints on the medallion and crosses. You may have experienced some of these practices and/or relics while caring for Hispanic patients in your former intensive care units. Some Hispanic cultures have unique traditional health beliefs and practices, and these are practiced to varying degrees. For example, some Hispanics have beliefs in hot and cold practices of balancing sickness. Aspects of hot states include hypertension, pregnancy, acid reflux, and diabetes. Cold states include menstrual cramps, colic, and pneumonia. To treat a hot or cold practice, one will often produce a remedy with the opposite temperature. For example, this includes making hot soup in the wintertime for cold states, like upper respiratory tract infections. Furthermore, many Hispanic cultures will use herbal remedies to treat illnesses. Some common herbals include echinacea, ephedra, garlic, ginkgo, kava, and St. John's wort. This can be particularly troublesome if the Hispanic patient does not share their use of these substances with you as a provider. Hence, building trust and resisting judgment is essential with these patients. When considering neuraxial anesthesia and analgesia for a Hispanic participant, understand that herbals may not be considered medications when asked on a formal history assessment. We need to ask about the use of herbal medications specifically. Lastly, it is imperative to know which herbal medications will affect both our neuraxial and general anesthesia. The Hispanic population's overall health often has multiple factors that have impact, including language barriers, lack of access of preventative care, and lack of health insurance. Language barriers can be overcome with the use of cultural linguistic services. These include telephone and video services that securely connect the patient and provider with an interpreter of the desired language. According to Schneider, providers should ask for an interpreter of the same sex as the patient to facilitate trust and comfort. For example, female patients can be uncomfortable disclosing their personal history to a male telephone operator. When in doubt, you can't go wrong with asking the patient his or her preference. Secondly, access to preventative care may limit a complete and thorough health record. It is optimal to perform a thorough history and physical to ensure a safe delivery of anesthesia. As access to preventative care and health insurance go hand in hand, it should be noted that the Hispanic population may be living in poverty and not have the means to acquire health insurance. This may result in Hispanic cultures to seek care only when illnesses are dire and traditional methods of healing have failed.
Now let's talk about some anesthetic considerations. Some report that Hispanic populations fail to report or underreport pain. As an anesthesia provider, it is imperative to have good communication with your patient and to treat pain promptly when indicated. It has been reported that 47% of Hispanic women receive epidurals during labor and delivery, compared to 69%, 64% of non-Hispanic white African Americans. Snyder proposed this was due to the resistance of Hispanic cultures to report pain. Oftentimes, Hispanic cultures either may not trust providers or feel that it is rude to interrupt and or question their providers. This can lead to underreported pain. Of note, it can also lead to the participant not understanding the anesthetic plan, but agreeing to one anyway in an attempt to not be a burden on the provider. According to an article published by the American Society of Anesthesiologists, the author stated, "We found that some Latino patients do not question their healthcare providers and may be left with unanswered concerns, which can lead to increased levels of anxiety." The article goes on to say Spanish-speaking Latinos reported significantly higher preoperative anxiety than Spanish-speaking Caucasians. With this said, we should be diligent in assessing pain, anxiety, and a true understanding of the anesthetic proposed. For reasons stated before, Hispanic participants may not always inform us of their understanding or concerns. Provider considerations. Outside of anesthesia, providers should take a few things into consideration. When turning into the literature, here are 2 points that emerged. Essentially, Merrill and Allen found that Hispanic participants were more likely to be dissatisfied with their overall health care and how their physicians treated them when compared with non-Hispanic whites, especially on provider dimensions such as listening carefully during a treatment encounter. Again, this points back to the values of the Hispanic culture. Of them, a personal, and genuine relationship that fosters respect comes to mind when examining this statement. Furthermore, an article from the Journal of Healthcare for the Poor and Underserved found that greater waiting time predicted dissatisfaction with healthcare among Latinos. Although it may be obvious that longer waiting times are dissatisfying for any culture, the Hispanic culture may take this as disrespectful, in that their time is not important to the provider making them wait. What can we do as anesthesia providers? As anesthesia providers, our goal is to always provide the best care we possibly can. This involves practicing cultural competency. If there is a language barrier between us and the patient, it is their right and in their best interest to receive professional linguistic interpretation services. This way, everyone is on the same page, and the patient and their family can make the best informed decisions regarding their health care. Respecting the patient and their family dynamic helps to build rapport and trust, and addressing the entire family, with an emphasis on the patriarch, may also be expected of us. If time allows, we should honor their religious practices. It is also possible that healthcare records may not be complete, language barriers, or lack of health insurance, so we should put on our detective hat when completing their history physical. This includes assessing for the use of alternative medicines, such as use of herbals and natural remedies. Knowing that pain may be underreported, we need to frequently assess for signs of pain and distress. Lastly, we should remember the classic Hispanic culture values: personalismo, respeto, confianza, and familiaridad. Okay, so knowledge check number 1. Which ethnic group is the fastest growing minority in the U.S.? A. Asian Americans, B. African Americans, C. Hispanic Americans, or D. Native Americans? The answer is C. Hispanic Americans. Knowledge check number 2. What are 4 of the most important Hispanic cultural values? Maybe A, B, C, or D. The answer is C. Familiarismo, personalismo, respeto, confianza. Knowledge check number 3. Which of the following do Hispanics commonly use to treat illnesses? And this is select 2. A. Hot and cold practices. B. Medications. C. Herbal remedies. D. Exercise. And E. Eastern medicine. And the answer would be A. Hot and cold practices. C. Herbal remedies. Knowledge check number 4. True or false? Hispanic patients will always question their healthcare providers if they do not understand a treatment plan. And the answer is B. False. And knowledge check number 5. What are some limitations to Hispanics and their access to healthcare? Select 3. A. Language barrier. B. Transportation. C. Insurance. D. Access to preventative care. Or E. Geographic exclusion. And the answer is A. Language barrier. C. Insurance. And D. Access to preventative care. And here's a list of our references along with the next slide. Thank you for listening to this presentation on Hispanic culture. And again, my name is Matthew Singletary. The other presenter is Emily Matson.